Happy to everybody that's listening to the sound of my voice. Hey, I'm your girl, Dr. Telisa Franklin. Y'all know what we're doing over here, right? We are having those conversations that matter to our community and to our culture. And when you're thinking about conversations that matter to our community and our culture, everybody is talking about the Southern Heritage Classic. Well, we got some more stuff to talk about doing the Southern Heritage Classic extravaganza. I am super excited to know that Baptist is sponsoring the 2025 Southern Heritage
That
Classic,
is exciting.
which
Absolutely.
will feature the Alcorn State Braves and the Arkansas Pine Bluff Golden Lions college football teams. This game will be held at the Simmons Bank Liberty Stadium in Memphis at 6 p.m. Saturday, September the 27th. Baptist will not only be sponsoring it, but providing health screenings from 11 a.m. to 5 p.m. in the tailgating area at Tiger Lane, Lot 15. Stop by on your way to the game and get your blood pressure checked, your colon cancer education, and your health screening passports, courtesy of all Baptist Cancer Center. But today I'm super excited to have a young man that's in to talk to a very important to me, and especially when you're talking about my African American brothers, colon cancer awareness and prevention. Catch that, prevention. Will you welcome with me? Baptist is on gastrologist Dr. Randy Smith. Hello there, Doc. How are you?
Hello, Dr. Franklin. How are you?
I am
Uh,
amazing. Thank
uh,
you for what you're doing.
well, thank you for having me. This is an important topic which is dear to my heart, as you know, and I
Absolutely.
love talking about it. Absolutely love talking about it. So,
I
especially
love
especially us. So, yeah,
Yeah, because
right,
as I was saying, and I say it so many times, we as a culture, I can't speak for other people, right? But as
right,
us,
right,
sometimes
right.
we have white coat syndrome, right? So we're
Absolutely,
afraid
absolutely, yes,
of white
absolutely.
coats. Kind
hmm
of tell us what has been your perspective to get people to get over that fear and to have those conversations and talk to you.
You know, I talked to him about the process. It is a 2 day process, not just the procedure itself. And most times I'm able to convince people the most difficult part about it is the day before, which is the prep, and the prep includes clear liquids the day before, a laxative that does not taste good, which is a very large volume, and it creates this horrible diarrhea. However, when you finish that and you come see me, which is what most people fear, that's the easy part because we put you to sleep and the test will last anywhere from 10 to 20 minutes. And it's not like a typical surgery where we're cutting. You don't wake up in any discomfort or anything. Most people don't even know they've had the test. I even have people argue with me that I never did anything. I say, no, you had a procedure. I assure you, I have pictures to show you. But once I convince people that the most difficult part about it is the day before, most people are comfortable proceeding. Now, once they get here, there's some nerves involved, but a lot of times we have medications to alleviate that anxiety. So yeah,
Awesome. So,
yeah.
many people saying,
Mm.
Talisa, what is this kind of what is a gastrologist? What is this and
Okay.
what's that? But we really
Uh,
want to dig in. What is colorectal cancer? Because a
okay.
lot of
Got it.
people have
Okay.
no clue what it is.
Got it. Okay. So I am a gastroenterologist, which means that I take care of everything that involves the GI tract, from the mouth to the anus is what we say. Okay. It could be anything from heartburn, indigestion, nausea, vomiting, abdominal pain, diarrhea, constipation, bleeding, weight loss, weight gain, all those types of things. That also includes the liver, the gallbladder, and the pancreas. So anything that involves the GI tract, I take care of. Now, what we're talking about today is colorectal cancer. That is a little different. The colon is an organ in the body. It's basically the end of the GI tract. Okay, it involves the colon and the rectum, which is called the large intestines. That is that primarily functions as a storage unit as well as absorption of liquids and nutrients. And when you talk about colon cancer, what that means is abnormal tissue develops in that area over time through a stepwise process. We think it takes anywhere from 5 to 10 years to develop a colon cancer. And it starts out as a very small polyp, which we can remove if we do the colonoscopy ahead of time, which is the preventive phase. but over time it develops into something larger that we can't remove, that we can't remove rather with the scope, and it has to be removed either surgically or if it's advanced, which is why we preach colon cancer screening and prevention early, which is not just a colonoscopy. I primarily do colonoscopies, but I'll talk about that later. There are other ways to screen or survey outside of colonoscopy that people are, if they're qualified to do, which is something we recommend as well. So obviously, I promote the colonoscopy, but basically any test you get is a good test, whether it's a colonoscopy, Cologuard, or FIT test. But getting back to colon cancer itself is a tumor that forms in the large intestines. Um, and it's probably one of the most preventable cancers that we know of, as well as one of the most curable cancers that we know of. We know it's the third leading cause of cancer in the world, but the second leading cause of cancer death, which is completely preventable with colonoscopies and treatable in some cases if you catch it early as well. So,
So when you're
mm,
thinking about catching things early, there is
hmm
a lot of men,
hmm
especially my brothers, that maybe have a
yeah,
father that passed away of colon
right,
cancer.
right, right.
Is colon cancer hereditary?
Mm.
So if the
It
dad
is.
had it, will the son have it?
It certainly is hereditary. There are a couple of syndromes that we talk about. One is FAP, and there's one called Lynch syndrome. Okay. Typically, the we recommend screening for colon cancer starting at 45. However, if you have a family history, meaning a first degree relative like a mom, dad, sister, brother, 60 or under, you start early. You start at 40 or 10 years younger than the diagnosis, which means that if they were diagnosed between 50 and 60, you start at 40. But if they were diagnosed under 50, you have to start 10 years, subtract 10 years from that. Let's say they were diagnosed at 45, you have to start at 45. So it is certainly hereditary. However, most cases are what we call sporadic, which means that we can't find a hereditary link. And unfortunately, we're seeing that at younger and younger ages, and particularly in our community.
Mm-hmm.
So anybody that comes in that I see, when I first started doing this, I questioned why would somebody do a colonoscopy on somebody who's 20 or 30 years old. But when I first joined this practice, the youngest person I saw with colon cancer was 21 years old, and she had stage 4 cancer. Okay. Now, if you don't understand what stage 4 is, there's no stage 5. All right. You start at stage 0 and you go to stage 4. That is the end stage for you. And that is 21 years of age. So I'm a little more aggressive in terms of screening and recommending a colonoscopy than I've ever been at this point, especially since we're seeing it at a much younger age and outpatient population.
Wow.
Mm.
What can people do to prevent it? Because I know people say, oh,
Uh-huh.
oh, 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 oh. What
Right,
can
right.
they do to prevent it?
Well, there are things that you can control and things you can't control. Obviously, genetics. You can't control your genetics, but you can control lifestyle. We know smoking, which smoking affects almost every cancer. We hear that with every cancer. Drinking, which we've heard recently. Several years ago, we were told that drinking in moderation or a small amount was heart healthy and these things. Now they're saying no amount of alcohol is healthy. Okay. We've adopted a Western diet, which is high in red meat, processed foods, those types of things are all carry an increased risk. And inactivity. Being active is very important. We don't exercise like we should. I'm guilty of that as myself. And I'll tell my wife, hey, I'm busy, but there's no excuse because there are other people that are busy and they exercise. So
Yeah.
we just have to get out and do these things. So yeah. But
So
those are some of the things. Go ahead.
one thing I want you, because I'm curious,
Hmm
I see people that is this new phase. I don't know if it's
hmm
what I'm just seeing it more. Is
Uh,
hookering. When
right.
they blow that smoke like some
Yes.
charcoal
Yes.
and put it
Yes.
in your lung. Is
Yes.
that
Yeah.
bad for people? Because some men
You
say,
know,
"Oh, when they say I ain't smoking cigarettes," but you put
well,
that charcoal in your body.
yeah, yeah. I mean, I that's sort of outside of my realm, and
Okay,
there may not be enough data or literature out there to suggest that that is, but it certainly couldn't be helpful. It's a toxin that's going into your body that's similar to smoking.
gotcha.
So, there may be some health benefits, but certainly there's some adverse events associated with it as well. And we just don't know at this point if it does have ever any impact on colorectal cancer. We certainly know cigarette smoking does, though.
What
All right.
about vaping? Because now this younger generation
Yeah, yeah,
are
yeah.
vaping like crazy.
There's no literature out there, but I'm sure it does. I'm sure
Okay.
it does affect that as well. Even marijuana, we know, marijuana does have some additional effects, but there's a syndrome called cyclic vomiting syndrome where if you reach a threshold where you smoke too much, typically, like some people use marijuana to control nausea and vomiting, but you can reach a threshold where you're smoking too much to where it causes episodes of nausea, vomiting, and abdominal pain. So too much of anything is not good for you. Basically is what I'm saying. Yeah.
Gotcha. So,
Yeah.
what is a colonoscopy? I know for me, when you
Uh,
said that
uh,
nasty liquid, I hated it.
it is not good. The good thing about it now is we have multiple prep modalities. We have pills, we have liquid. When I first started this, we only had Go Lightly. It was just a gallon of like ocean water. It was awful tasting, no flavors or anything. Now we have pills. We have powder that you can mix with Powerade or Gatorade, and most of the things we have now less volume. So it's probably 20 ounces. You just have to drink a lot of water with it. So
Mhm.
that's where it starts. Clear liquids the day before the procedure. Let's say you're going to get it done on a Friday. Thursday we do clear liquids. And when we say clear, clear soup, nothing in it, no meat, pasta, vegetables, or anything. And then you start to prep later on that evening. Most times we do what's called a split prep, which helps us which actually cleans you out better, which is important because the cleaner you are, the more thorough tests that I can do, and the safer the test because it doesn't take nearly as long, which requires less sedation as well. But you start to prep the day before Thursday, let's say. You finish the prep, and then we will tell you not to eat or drink anything after midnight. That's for safety purposes. We put you to sleep for this test, and that relaxes you quite a bit, including the swallowing mechanism. There's a little flap that I tell people that protects the lungs when we swallow.
Mhm.
Sometimes if there's something in the stomach and you sleep, that flap does not work as well as it should. If you throw up, that can go into your lungs and cause pneumonia or even kill you. So, we try to impress that upon patients, but you don't eat anything after midnight. You come to our office. It's about a 2 to 3 hour process from the moment you walk in the door to the moment you walk out. You're evaluated by a nurse, then by an anesthesia provider. They put in an IV. Through the IV, we give you the Michael Jackson made this famous, the Michael milk of the propofol. But it's an excellent medication because it works fast and wears off fast. Within 5 or 10 minutes, you're awake and like you were when you came in. And we know it's safe because it wears off very fast. They have to keep giving it to you throughout the process, otherwise you'll wake up. But you're breathing on your own. Some people move, some people talk. You just don't remember any of it. Okay.
Mhm.
And it's a restful sleep, a restorative sleep where you feel rejuvenated afterwards. All right.
Yes.
And like I said, most people don't even know. I've had people argue with me that we never did anything.
Wow.
Nah.
So, how has the screenings evolved in the recent
Uh-huh.
years? I know now not the nasty liquid, but I still got
Right.
that's a liquid. I don't know what's up.
Right. Yeah. Yeah.
You a
Yeah.
pill.
Right. Right. You
But
know,
what
I
other ways have it evolved in the years?
so so you don't necessarily have to do a colonoscopy. There's a test called a Cologuard where we call it screening in a box. They'll send you a box to your home. You deliver us a stool sample. You send that back and it comes back positive or negative. The advantage of that is you don't have to go through the prep process for colonoscopy. You don't have to go through the procedure yourself. It's less expensive than initially, but you have to do it every 3 years. So when you look at in terms of expenses, if you're doing this every 3 years and you have to do it within a 10-year interval, it's going to cost more than a colonoscopy. In addition, if you get one that returns positive, you're going to have have a colonoscopy anyway. Okay. Now, those are only indicated for patients for screening. If you've had polyps before, if you have symptoms of bleeding, if you have a family history, that's not appropriate for you. Okay. A colonoscopy is the next one, is the best test. Really, the best test is any test that you get, but the colonoscopy is the recommended test. There's another one called a FIT test, FIT. That test is done yearly, and it's sort of a blood-based. It's just it detects blood in the stool, not a blood-based test, but it detects blood in the stool, and that was done every year. Now, the last two tests, they're not screening, okay? There's a difference when I say screening as opposed to diagnostic. Screening is a colonoscopy. That's basically done as a screening modality to prevent colon cancer. Okay, the Cologuard and the FIT test are tests that are done to diagnose colon polyps or colon cancer because they're not going to be positive unless you have polyps or something else in there. Okay, so those are totally different. Sorry, I'm getting some alerts here. You can see, yeah, but those are going to be totally different. So once again. I do colonoscopies, but we also do Cologuards and fit testing. But the best test is a test that you decide to get. We just want everybody to get tested. It doesn't matter what you get, okay?
Absolutely.
And
Do
and
something.
you're covered. Absolutely. Yes.
So
Yes.
are there any warning signs? Maybe, we unfortunately we have uh
Uh-huh.
some brothers, and I say brothers because we're in
Right.
football season. We have some brothers that
Uh,
don't go to the doctor,
oh yeah, absolutely.
a
Absolutely. Yeah.
wife or a sister or mom say,
Uh-huh.
you going, right? Or
Right, right, right,
they
right,
can't take it no more.
right,
Are
right.
there some warning
What
signs?
so we do the most common symptom is no symptom at all, but there are what we call alarm symptoms or alarm signs. Those are changing your stooling pattern. Let's say you may go from having constipation to diarrhea or vice versa. There may be a change in the caliber of your stools. You may have abdominal pain, bleeding, or abnormal and unintentional weight loss, iron deficiency anemia. Those are all alarm symptoms that we use in order to recommend or suggest undergoing a colonoscopy. So yeah.
Wow.
Mhm.
So are we seeing increased numbers for younger adults now
Yes,
than
yes,
ever
we are.
before?
Yes, we are. And people under 40, we're seeing an increased risk of colon cancer in people under 40, especially African American patients under 40. And we they don't know definitively why. Uh, they call it the birth cohort, which is a complicated way of saying it could be some environmental exposures, things like antibiotics, once again, sedentary lifestyle, those types of things. Uh, and these are all, this is all speculation. We don't know for certain why, but we certainly know that we're seeing it at a younger age. Okay.
Wow. And
Mhm.
so why is because sometimes people will say, Talisa, you always talking about this, that, and other. And I'm like,
Uh,
you need to take your butt to doctor. You need to take your butt
Right.
to doctor.
I mean, you
Well,
you can't say it enough, Dr. Franklin, because we're the goal from our organizations has been to get to a screening goal of 75% of everybody. We're probably only at about 55 to 55% of people getting screened and need to be screened.
wow.
So you can't say it enough. And I'm sure it's the same for other screening modalities as well. So
Absolutely.
yeah,
So
yeah.
what's the survival rate if for why is early detection so
Uh,
critical?
Well, that survival rate is stays dependent. With any cancer, if you catch it early, with most cancers rather, if you catch it early, the survival is going to be much higher. And it also affects the treatment as well. So let's say with rectal cancer or anal cancer, if you catch that early, those are probably, we say this, if there's any cancer that you want, anal cancer or rectal cancer is probably the one because they respond very well to chemo. Radiation respectively. So, and actually, there are some studies where there's a subset of people with rectal cancer where it's completely curative, but it was a small study and it's ongoing, but it's something that's very promising that we're seeing in terms of treatment. You know, and
Wow.
there are different treatment modalities depending on the staging. Stage 4, obviously, there are no, you're not treating for a cure. You're treating, just to prolong life. But if you catch it early enough, it's one of the few cancers that we can actually cure.
Wow. And I could just say
Hmm.
like this in the Black community, there are so
Hmm.
many misconceptions about
Right,
life at this point, right?
right, right,
Especially when you're talking about our health. But what
right.
are some of the misconceptions about colon cancer do you hope to correct, being that you are a man of color?
Well, one is it only affects people, older people. Okay.
Mhm.
Um, I hear that a lot. I'm too young to have colon cancer. Yeah, you probably are, But what if you're a part of that small percentage? You know, you can do an inexpensive test, which takes maybe a few hours out of your day to give you peace of mind that, hey, everything's okay. There's nothing in there. Or Dr. Smith removes some polyps that could have grown into something more serious down the road. Okay. That's one. Another one is I feel good. I don't have any problems.
Mm.
Why should I get that done? I never had it before, never had any problems. I hear that a lot as well. I also hear, hey, I can't afford it. If you have insurance, that's a moot point. Insurance covers everything, all the screening costs. It covers all of that. And probably, with guys, some guys feel like, well, I don't want anybody messing around back there. It's unfortunately, women don't want anybody to mess around, but you understand the importance of undergoing screening. And I think, in my opinion, that overshadows any issues that you may have or any preconceived notions you may have about undergoing a rectal exam or those types of things. So
So,
yeah.
men,
Mm.
you heard it from another man that
Hmm.
it's okay to get your
Right.
feet checked out so you
Right.
can
Right.
live
Right.
longer. Because us ladies
Right.
need y'all around men.
Right.
I'm telling
We,
y'all,
I
we
know,
need
I know.
y'all.
We need you guys to, we need you guys to absolutely. We can't do it without each other, especially during these trying times that we're in now, particularly now. Yes,
Yes. So,
absolutely.
why,
Uh,
Doc, there's so
mhm.
much of a stigma on everything.
Right.
Why is it important to even have these conversations about colon cancer openly, despite the stigma?
Because we know if you catch this early enough, you if you diagnose colon cancer early enough, it is improving what we call morbidity and mortality. It adds years to your life as well as minimizing the burden not only on your family, not only on the health insurance industry, but on your family as well. Especially, you know, let's say you have small kids or you have teenage kids. Most of us want to be around for those kids. When to see them graduate and have grandkids, and it's important that we do the things now uh, that will allow us to live and enjoy those years that are promised to us in the next 15 to 20 or 30 years, but for some of us. So, but that starts now. You can't wait until you're 70 and 80 and start saying, "How I want to start doing things to live longer." That doesn't work that way. By that time, the damage is already done. No.
Right. And
Mhm.
I think so many times we do wait till it's too late,
So
and
until it's too late,
all
yes.
you have is that short term
Right, right,
memories, which if you would have did
right.
it on the front end, and of course, I always tell people sometimes we are more reactive
Reactive
versus
than
proactive.
proactive. Absolutely. I agree
And
100%.
if we become more proactive,
Hmm.
I
Hmm.
believe that we can
Hmm.
save lives and kind of pause some of the pain
Absolutely.
we have.
Absolutely. 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 I mean, and in medicine, we talk about primary prevention, secondary prevention, and tertiary prevention. Colorectal cancer screening is primary prevention. Okay. And when you get the tertiary prevention, you're basically treating, you're not preventing anything at that point. So,
I love it. Doctor, is there
mm.
anything that I forgot to mention that you know that
um,
people need to know?
just thought it starts it starts at home, followed by establishing a good PCP and having that conversation with your PCP. We have steps in place, reminders in place. Most of us, especially if we have an EMR, that will remind us when we see patients that, hey, this is a screening modality that this patient meets the criteria for that has not been done. Just have that conversation with your PCP. What is it that I need to do at my age? What's recommended at my age that needs to be done? Whether it's getting sort of a colonoscopy for women, mammograms, PSA checked, all these types of things, all very important. Not just colorectal cancer screening, but all those things are extremely important. And it's a conversation that starts in your PCP's office. All right, and I always tell lots of PCPs out there. If you're not happy with the one you have, find another one. You
Absolutely.
don't have to stick with one you're not happy with. All right. And ask questions. One thing when I see African American patients, I don't mean to cut you off,
Oh,
is
you're
that
good because
I
I ask all
always
the questions.
I always ask, why do you take this medication? I said, well, I don't know. I said, I never want to hear that,
Yeah.
especially from us. Okay. Ask questions. We would love to walk in the room and walk out and tell you something, walk out. But you get much better care when you're involved in your care, asking questions. Why? Why is this? Why do I have to do that? What is this medication for? What are we treating? Can I do this? And I'm the first also to recognize I always not the only way. There, research these things online, and and look for alternatives and be prepared. When you go to your doctor's office, you have a much better visit than if you're not.
Absolutely. Well, I tell you, Doc, one thing about me, my doctor know I ask everything from coming from
And,
the front door all the way back to the front door.
and you should. And I don't know if you could tell, I'm a talker. My nurses frequently tell me, you need to stop talking so much. You need to speed up. You need to speed up. I can't
Keep
help it,
talking.
I may have one or two where I speed up, then I'm back to where I was before I'm talking. So,
Right. And
uh,
you know what? I
mm,
tell my doctor if I'm going, if you I saw slow
right,
down. We talking.
right.
I
And
don't
that
care
and
how
that
many other
that
patients you
that's
got. Right
that's
now,
what you
baby,
have
it's
to
all
do.
about me.
That's what you have to do. That's what you have to do in order to get good care, especially in our community. So for us,
Absolutely.
rather, let me say that. Yeah, yeah,
Absolutely. Doc,
absolutely.
I appreciate you. Listen, family,
Uh,
I want to remind y'all that
mm,
Baptist is sponsoring the 2025
uh,
Southern Heritage
so
Classic,
here's
which
class,
will feature Alcorn in Arkansas.
right,
Listen, make sure if you get to the pregame, you get to the tailgate, go over to Baptist, get your
right.
blood pressure checked, get your colon cancer education and health screening passports. Listen, and please get those blood pressure checks. Black
A-
men,
abs- Absolutely, absolutely. And Dr. Franklin, thank you for having me. It's been a pleasure talking to you. I would love to meet you in person one day.
absolutely.
But once again, and I love doing this. So anytime, anytime. All
Yeah.
right.
And
All
so,
right.
Doc, you can be
Uh,
reached at baptistonline.org, correct? Because
yes, yes. GI specialist is what we call GI specialist. So, all
so
right.
y'all
All
that's
right.
listening, y'all make sure y'all get about the business and take care of your colon cancer. Know that I am colon. We don't want you to have cancer. But if you do,
Right.
Doc gonna
Right.
got a plan for you, honey. The
We got a
Lord
plan for you.
got a plan for
Absolutely.
your life, and
We're
doctors
gonna
too.
take care. Absolutely. Absolutely. All
All
righty.
right.
Dr.
Thank you
Franklin,
so
thank
much,
you.
Doc. I
Take
appreciate
care.
you.
I appreciate you as well. All right.
All
Take
right, to
care.
y'all that's listening, to y'all that's watching, until next time, know that I love you, baby. Absolutely, positively love you. And there's nothing you can do about it. Make this day, make this moment, make this second the best ever. And you know what? Learn how to be the best version of you. Why? Because everybody else is already taken. Until next time, be blessed is my prayer for you.